Stress, a word filled with negative connotations, often associated with the emotional response to distress, feelings of dread, anxiety, lowering performance, as uncomfortable feelings concern the individual, which can lead to more serious outcomes on mental and physical health. However, stress can be also positive, known as eustress, which can be beneficial, being a catalyst for increased performance as excitement manifests as increased energy, focus, and motivation. Any stressor can be determined as internal from the assumptions regarding various situations based on personal beliefs and experiences. This stress is self-generated, or external, out of personal control from the environment. These can range from minor inconveniences to major life events. Everyone experiences stress, and the body is equipped to manage stress and can be essential for survival when the response is healthy and proportionate. Common sources of stress include day-to-day stressors, frequent low-level mundane pressures which can be disruptive, such as work and education concerns, navigating relationships and other responsibilities that are routine activities that add to our stress levels. Unexpected negative stressors are unforeseen events exceeding the regular coping capacity. Stress levels increase abruptly. A serious accident at work or on the road, financial struggles, and family breakdown are examples of these that are outside the daily expected parameters. Increase in demand on emotional and mental energy levels, which can impact our daily life. Stress related to trauma is a significant event that an individual experiences, such as abuse, physical assault, incidents of warfare, or disaster. This often leads to emotional extremes of either being overwhelmed or the numbing of emotions. This can lead to post-traumatic stress disorder, nightmares, flashbacks, and can have long-term implications. Those who experience this as a child often have a harder time regulating their emotions. Acute stress comes on quickly, can be impactful, but is short-term, such as an exam, an interview, or an argument. This can become episodic when acute stress occurs frequently and the person is unable to return to a relaxed state, often experienced by healthcare workers. Chronic stress lasts for extended periods of time. Financial instability, relationship breakdown, work overloads that continues for weeks or months. Symptoms can be difficult to detect, which can lead to long-term mental and physical health problems when unaddressed. Personal problems, including relationship difficulties, arguments, setting boundaries, and feelings of loneliness. Life-altering events such as new work opportunities, relocations, and losses can be challenging. When an adjustment is forced, it is essential to manage the emotional toll. Physical and mental health have long been linked, each having an impact on the other, whether this be short-term or long-term. The impact of stress is individualized. Identifying stressors and the levels of stress being experienced help manage health mentally, physically, and emotionally. Seeking help and support when it is needed is crucial. When experiencing stress, which can be short or long term, individuals can display signs and symptoms that can be cognitive, physical, emotional, or behavioral. Cognitive symptoms can affect concentration, you can have difficulty remembering or making decisions, which can develop into dementia when routine stress is overbearing. It can also impact self-confidence and leave you with feelings of worry. Physical implications include headaches that are notable when handling routine stress and personal stress, which can lead to dizziness and fainting. Inflammation is often seen with symptoms of routine stress. Muscular pain and tension are also part of routine stress, as the muscles are unable to relax and neither is the mind. Digestive issues such as nausea, diarrhea, which are intensified when someone is navigating through personal stress sources. Cardiovascular issues, including increased risk of heart disease and attacks associated with most stress sources. Skin reactions like eczema are visible, or rashes. Impacts on sex drive. In men, the production of testosterone is affected, impacting sperm creation and maturation and even erectile dysfunction. And in women, their estrogen levels are impacting, affecting natural cycles, with the potential of PMS. Increased blood pressure increases the risk of stroke, which is often associated with high routine stress levels from prolonged periods. Fatigue and a lack of motivation for exercise. Other bodily functions are affected, such as the natural immune system. Panic attacks affecting respiratory system, with shortness of breath or fast breathing exacerbating other respiratory disorders. Accelerated aging of the cells, such as the skin, and decrease in bone density, increasing the risk of fractures. There is also disruptive to sleep, which can lead to insomnia. Eating patterns can change, increasing the risk of obesity, diabetes, or anorexia. Withdrawal due to low self-esteem and disconnecting from friends and society. Undesirable habits such as nail biting, fidgeting, pacing from agitation and nervousness. Increased use of substances such as drugs, alcohol, coffee. Responsibilities are being neglected and your performance is impacted. And when those that have experienced traumatic stress often avoid triggers. An emotional toll includes low morale, mood change with increased irritability and inability to relax, often seen in increased workloads of personal stress. Feelings of helplessness, depression and anxiety, often symptoms of traumatic stress as well as personal stress, leading to feelings of overwhelmed, guilty. Experienced stress during pregnancy can also impact the growing fetus, being associated with emotional dysregulation, ADHD, behavioural issues and cognitive development delays. Anyone who experiences any type of stress can experience any number and combination of these symptoms. It is important to be able to identify and manage stress effectively and seek support when it is needed. It is essential to utilise coping strategies and mechanisms to minimise the impact and to preserve health and well-being. Coping strategies can be healthy and unhealthy, but the first and most significant step is identifying the cause. Failure to do so could only give temporary relief or even make a situation worse, as the root cause is not being addressed. It is vital to take control of the situation and challenge yourself. Writing down clear goals in a plan of action can be empowering, giving back control and a sense of direction by providing more manageable ideas that encourage and maintain motivation. Make time for yourself to do activities you enjoy, socialise, relax. This could include calming exercises such as deep breathing, meditation, and even physical activity. This can help with clarity and lowering the emotional intensity as exercise releases endorphins, increasing mood and energy levels, and facilitating restful sleep. This can also have a physical impact by lowering blood pressure and the heart rate as the body and mind relax. Connect and socialise. Having a supportive network, friends, family, colleagues, aids mental and emotional well-being, offering new perspectives with appropriate boundaries of what is and isn't acceptable. It is essential to recognise that some thoughts and feelings may be extreme and uncomfortable, such as self-harm, suicidal thoughts and auditory hallucinations, which can be incredibly disruptive to emotional state. It is essential to understand that these feelings are real, acceptable and short-term and do not define us. You can manage this by being open and honest about discussing these uncomfortable feelings, which will give you power over them. Discussing them with a trusted person or professional allows for the receiving and perceiving of new perspectives. Seeking professional help from mental health specialists who have the expertise in the field to offer guidance and treatment in a non-judgmental environment. In cognitive behavioural therapy, an experienced professional assists in the recognition of negative feelings and behaviours and has access to resources to change these into positive actions and emotions over time. Coping mechanisms provide relief, whether immediate or slow over time. Still, all can be classed as either adaptive, a positive, healthy and beneficial strategy that tackles the problem and the source of stress, or maladaptive, short-term relief in which the strategy is masked and the problem ignored and the root cause is not addressed. During which category a strategy is placed on is dependent on the context and the circumstances during the use and the impact it has. When developing coping strategies, these are either emotionally focused, which give better responses to stressors by altering perception, or problem focused, which modify and limit sources of stressors. The effectiveness of a coping strategy varies based on personal characteristics, experiences, and perspectives of the user, as well as the circumstances in which they are used. That's why it is essential to be open to new things when trying to curate a personalised plan in managing the effects of stress on physical, emotional, and mental well-being, as the effectiveness of the strategy can only be measured by the quality of life of the user, meaning a level of understanding of personal stresses is required, and the accepting that it is a natural response can intensify for any number of reasons, affecting the efficiency of strategies. Incorporating such things as balanced diet, exercise into a daily routine can improve self-awareness and greater emotional control, which improves resilience in the long run and aids chronic stress symptoms. Using methods such as deep breathing, meditation, and progressive muscle relaxation techniques can help to achieve focus and clarity and can assist in handling acute stressors.